Well, welcome all. On behalf of the Association of State and Territorial Health Officials, also known as ASTHO, we are pleased to present this webinar entitled Facilitating the National Public Health Performance Standards State Assessment Process. My name is Denise Pavletic, and I'm the Director for Public Health Systems Improvement at ASTHO. First of all, congratulations on taking on the National Public Health Performance Standard State Assessment. We hope that you find the information in this webinar helpful in your preparations for it. Today's webinar goes beyond just general facilitation techniques for the performance standards and focuses on facilitating the version 3 instrument. And today we have with us one of ASTHO's consultants, Dr. Brenda Jolly, to present the information. Brenda Jolly is a member of the public health faculty at the University of Southern Maine, where she teaches both graduate and undergraduate students and leads several research and evaluation projects. Her interests include program evaluation, public health systems research, performance assessment, and quality improvement measurement. She recently facilitated Maine's statewide public health assessment and is currently serving on the national evaluation team for the NPHPS project. Brenda earned her master's and doctorate from the University of Southern Florida College of Public Health. So Brenda, I will turn it over to you.
Great. Thank you, Denise. Well, let me start out by echoing your comments and congratulating everybody for taking part in this assessment process. I agree with Denise. I think this is clearly an indication of your state's commitment to bringing partners together to identify your strengths, your gaps, and opportunities for improvement. As you all know, this is an important step that will lead to the development and implementation of an improvement plan for your statewide public health system. I'm delighted to have the opportunity to provide this training to you. As Denise indicated, I too hope this is a good use of your time. What we've tried to do with this training is align it fairly closely with the facilitator's guide and also the material that's in the toolkit. And then I'm also going to be drawing on some of my own personal experience leading these types of assessment efforts at both the state and the local level. So this training is meant to prepare you to lead the assessment using the National Public Health Performance Standards Program, the statewide assessment tool. But there are probably some decisions and questions you'll need to discuss also as a group or a planning committee. So what is this training going to cover? First, I'm going to provide a little bit of background in terms of the purpose, your roles as either facilitators or note takers, and the agenda for planning this meeting. I'm also going to cover some of the specifics around what you can expect as a facilitator and a note taker, walk you through an example for one essential public health service, and share some of the tips and strategies that I've learned along the way. And then finally, I wanted to just spend a little bit of time at the end talking about meeting logistics, again, based on some of the lessons that I've learned as I've conducted these types of assessments. Okay, so let's start with the background. I think it's really important for all of us to know the purpose and the impetus for this assessment, as well as the roles, the structure for the day, and the next steps. I suspect that you and your team already have an agenda for the assessment because you've convened all the facilitators and the note takers for this training. So whether your agenda is final or still a work in progress, you've got some idea of how you're going to structure the day and the breakouts that you plan to conduct. In my experience, it's really helpful to have an internal working agenda that can provide some great talking points and some background information that's useful for facilitators, especially for facilitators who haven't been part of the planning team or for facilitators that are new to this type of process. It may also be helpful for you to have a bit of background on the latest version of the tool. And I wanted to just spend, a minute or so giving you a little bit of that background today. So as Denise indicated in her introductory remarks, this is version 3, which is really exciting. In version 1, this instrument was released in 2002, and it was used for 5 years. More than 30 states used it, and there were approximately 900 scored questions on that first initial version. The second version was actually revised based on feedback from the field and was used in 2007, right up until this third version was released. There were approximately 600 scored questions on this version. So shorter than version 1, but still a fair amount to get through and vote on. This third version is sort of new and improved. The goal is to sustain and enhance the National Public Health Performance Standards as a tool for system building, assessment, and improvement activities. And the re-engineering process was really designed to streamline the assessment tool. There are now about 115 scored questions for the entire assessment, so that's dramatically less. And the re-engineering process really focused on strengthening the linkages with accreditation and promoting quality and performance improvement. This version is still based on the statewide public health system, not just the state public health agency, and it's structured in very much the same way. So having a little bit of that context is really helpful, and also, you know, if your state has participated in a prior assessment, knowing what that assessment entailed, what some of the results were, at least having a cheat sheet in front of you is very helpful, especially if questions come up in your session about what did we learn the last time, or where did we score the last time for this particular essential service. So that's a little bit about background. Let's talk now about tips for preparing. What are some tips that I can share with you, again, based on my own experience? As I just indicated, really understanding if you've done a previous assessment, what the process was, who participated, and some of the overarching results can prove to be really helpful. I've also learned that having confidence in the process goes a long way. There are limitations to any type of assessment that you do. I mean, let's face it, no process like this is perfect, and there's always a fair amount of subjectivity. And for some people, that's anxiety provoking, and they tend to question the process and how credible the results will be. I've found that if you really exude confidence in this process, if you as a facilitator believe that you are going to get meaningful data and you can convey that level of confidence often flows to the participants or the group members. So some of the things I usually say is this tool is validated. It's been used extensively. It's in its third iteration. Multiple states have used it and have actually been able to document a snapshot of where their public health system is and identify really concrete opportunities for improvement. I also talk about how several types of meetings work, and the retreat style, or whatever style you use, if it's a core team with the same group that answers all of the assessment questions, or if it's a retreat style where you actually have breakout sessions, everybody's there on the same day, and you separate based on people's areas of expertise. I always give people confidence that these various approaches work, and they make sense for our state, and here's why. We're only able to get people together, but we know the people we have are the people we need to participate in this process. I also reiterate how important it is to get diverse opinions and to hear from the participants. We want people to participate and actively share their input and feedback on how well our state public health system is doing. So I talk about how the discussion is as important as the votes themselves. And then finally, we want to focus on an assessment like this on how we're going to use the data. And in the overview session with all participants, that's a great way to sort of set the stage for what this assessment means and how the data are going to be used. And then for you as a facilitator, when you get into your breakout session, this is a great way for you to jump off of those introductory remarks that went out earlier to the whole group. So having confidence in the process, again, and relaying that confidence to the participants can really help set the stage for a smooth assessment. Okay, so now let's talk about making sure you feel prepared to lead your sessions and to capture the scores and comments. For this part of the training, I'm going to be focusing on expectations of facilitators and note takers, ground rules, and I've got several that I want to share with you, again, based on my own experience and other states who have done this, the documents that you will need to have on hand in the room, tips for getting started, and then I want to get into the tool and the voting process in a fair amount of detail so you really feel prepared to facilitate and lead these breakout discussions. And then finally, some strategies for actually capturing the scores and capturing the comments. In terms of expectations, some of these are obvious, but I always think it's helpful to articulate them anyway so that everyone's on the same page. So for facilitators, you want to be familiar with the sections you've been assigned. Again, if there are previous scores, you want to take a look at the items, the discussion toolboxes, any potential sticky issues, and if possible, know who has signed up for your session. I know from my perspective, I always like to know who's been at least invited to my sessions, and if there are a few individuals that I know these are hot button issues for them, I can anticipate where there might be some debate and discussion that might be lengthier than other areas. Your role as a facilitator is to guide the discussion. You set the tone. You need to facilitate with a firm yet a friendly hand. But there's a lot to get through, and there's not an unlimited amount of time to do this. So you really do need to play the role of facilitator. I've found that it's very helpful to develop a plan with the note takers prior to the session so that both the facilitator and the note taker know how to best work together. So, for example, are you planning to use flip charts for anything? Who's going to count the votes? We recommend that it's the note taker, but do you guys want to take turns? Do you want to get participants involved in that process? Who's going to provide recaps? Does the facilitator want to provide the recaps? Does the note taker feel comfortable doing that? What does the note taker do if they have a question? Do they raise their hand? Do they interrupt the process? Is there some signal that you guys want to have? Where should they be positioned in the room? And if you're going to have PowerPoint slides, who's going to be manning the PowerPoint slides? From the note taker's perspective, obviously your role is to record the votes. In my experience, preferably on a paper copy. Just bring, one hard copy of the instrument and record the votes. Now, as a group, you'll want to decide if you capture all of the votes or just the final scores. In my experience, I've done it both ways. It's a lot lengthier to capture all of the votes for each response option, and you all probably know that given the algorithm, there can only be one score per question that goes into the system. So I've found that it's most helpful just to capture the final score. If there's a tie or if it's close, you can make a note of that. If there's a tie, you can go with the more modest one or engage the group in more discussion to see if you can break that tie. But you'll want to probably have some consistency across all your breakout sessions. So you'll want to decide as a group how you actually want to capture the vote. You may want to record your comments on the laptop. And finally, as the note taker, you're in a position where you can pull out the glossary and provide definitions if necessary. And for both of you, I think it goes without saying, but I'll mention it anyways because I feel compelled to, that as the facilitator and the note taker, even though you may have a lot to contribute, your role is not to participate in the discussion. Your role is to take notes and to facilitate the process, not to chime in with your own input or feedback. Okay, so the ground rules are something you may want to mention in the general session, in the general introductory session with all participants, or if you prefer, this is something that facilitators can review in the individual breakout sessions. I find that this works well if you can do it in both places. The facilitator can reference the introductory session, remind participants what they are, and ask participants if there are any others they want to add to the list. It's helpful, I think, to have a common set of ground rules across all breakout sessions and to know in advance what at least that common set is going to look like. Some examples that I've found have worked really well is being very clear that everyone was invited because he or she has something to contribute. You're here. We want to hear from you. Please participate. You don't want to have a group where there are, half of the participants are quiet and silent, and you're trying to really, work hard as the facilitator to get their input. You want to be clear about that expectation up front. Also, I think letting people know that as a ground rule, you're all agreeing to work with an imperfect process. You recognize there are limitations with this type of assessment as with any. Let's not get bogged down on the process itself. Let's work through the questions, get good feedback, and try to meet our goal, which is answering all of the questions in our allotted time. And then also letting participants know that it's okay to respectfully disagree, that you're not anticipating that everybody's going to be in complete agreement. As a matter of fact, you're expecting that there's going to be disagreement or different points of view because everybody's bringing a different perspective to the process, and that adds to the value. So letting them know it's okay to respectfully disagree, and also encouraging them to, let the group know why. And then as a planning committee, you may also want to come up with, one or two more ground rules, or open it up to participants to see if they have anything else they want to add. In terms of the documents needed, the facilitator will want a copy of the instrument, although I will say I think the facilitator guide is probably going to be the best document for the facilitator to have, because it's a standalone guide that actually has all the questions, the narrative, and will guide you through the process, including the voting. So if you have that facilitator guide, at least for the sections that you're facilitating, maybe you're not involved in all 10 of the essential public health services, so at least print out the introductory comments and be familiar with the sections that you're facilitating. I think that's a great start. Also having an agenda, and if your group decides to do an internal working agenda, obviously bringing that along, because that will have lots of talking points for you as the facilitator. And then also I like to know who's going to be in my room, and not that we have a seating plan, but I do like to make sure that the room is set up in a way that's conducive to engage the group in a discussion. The note takers will want to have the instrument for recording the scores, and again, I think our recommendation is that you do it paper and pencil. It just seems to be a quicker and smoother process. Also, having a notes template, which is optional, some way to capture the qualitative feedback, all of the discussion that you're hearing, in a way that's going to be manageable and systematic across all breakout sessions or all groups. And then a copy of the glossary to be able to provide definitions quickly as concerns come up around how a certain term is defined. Okay, so in terms of getting started, as a facilitator, you're in your room. What's the best way to engage the group in this process? Well, you don't have a lot of time for comments, but it's important to welcome the group, do introductions, share your enthusiasm, share what the charge is of the group. If you can, I think it's really important to reiterate some of the key points from the general discussion. Things like this is focused on the public health system, not our state public health agency, that we have, this amount of time to get through this, and we're going to do it, and I'm committed as the facilitator to making sure we stay on time. And then talking about, again, how the results will be used. You'll also, during your introductory comments, want to discuss the expectations. You'll want to discuss the ground rules, and then you'll want to hold up the voting and the voting cards, if you're in fact using voting cards. This isn't a consensus building process. It's based on majority vote, by minority opinion, and comments will be captured. You'll want to give them some feedback just about the voting, maybe one or two sentences just like that. You'll also want to make sure that you've addressed any outstanding concerns. And then finally, one thing you may want to consider doing if time permits is a quick and easy icebreaker during the round robin introductions. This is especially helpful for getting people to connect with one another in a group setting, and there are 3 fun and easy ideas in the toolkit for incorporating an icebreaker into your session that actually shouldn't take a lot of time and should help to set a comfortable group dynamic. So the tool, let's spend a few minutes talking about the tool. This tool, as you all probably know, is based on the 10 Essential Public Health Services framework, and it includes 4 model standards: planning and implementation, state and local relationships, performance management and quality improvement, and public health capacity and resources. So each essential public health service has those 4 model standards and a series of questions under each of those 4 model standards. The tool also has discussion toolboxes embedded in it, and these serve as prompting points related to specific questions. So they can help clarify the intent of the question, they can prompt the group to consider all facets of the topic, they can actually trigger discussion in another area, and these are really helpful to use if you get stuck. So I'd encourage you, for the sections that you are facilitating, to be very familiar with what's in those toolboxes, because I think they can be really helpful in the process. So using the instrument, what should you do as you're getting started? Well, basically, for your essential public health service, you'll want to read what that essential public health service is, and then underneath it, there are 2 questions that it addresses. So you'll want to read those out loud. You'll want to briefly summarize what the essential public health service includes. From the narrative below, you'll want to highlight who the major players are that contribute to the delivery of this essential public health service. And then you'll fairly quickly want to transition the group into a general discussion. So you'll want to discuss what and how we're doing in this essential service, to get them talking, to get them thinking about the elements that are related to this essential service. You'll want to get them focused on the system, again, not a public health agency, but the statewide system. And then as the facilitator, you'll want to summarize key points. And then once that is done, once you've launched in, then you'll want to transition to the first model standard. Okay, so you've done the introduction, now you're into the model standard. What do? You read the model standard. You can either read it yourself or get a volunteer, which can be a nice way to keep people engaged. In the facilitator guide, there's actually an abbreviated version of the language around the model standard that you could potentially read. And this might be helpful, especially if everybody has a copy of the instrument, at least for their section that they're participating in, right in front of them. You can read the abbreviated version. I often let people know how many questions this section addresses. I'll let them know, okay, we've got 3 questions to address related to this first model standard. And then I'll jump in. I'll ask the question. Then I'll use the discussion toolbox to guide the conversation, and I'll periodically repeat the question just to make sure to keep the group focused. And then I'll point to people. Everybody will ask for a raise of hands. People will chime in fairly quickly, and oftentimes, a lot of hands go up. So I'll just call people off, write their name on a list, and go down the list and keep adding people to the list. But that way, I've got a running log of who's next. So that's basically all there is to it. Then for the voting. Participants may have, a handout of this, or you may choose to put this on a big poster in the room. Ideally, there's lots of different ways to do this. The process that I'm suggesting now, I think, has been proven to work. So ideally, participants will have voting cards, color-coded voting cards, that coincide with, the language. So they'll have, for example, a green optimal voting card that reflects an optimal level of activity. This is the public health systems doing absolutely everything possible for this activity, and there's no need for improvement. So you will have read these voting response options and held up, hopefully, the voting cards during your introductory comments, asked everybody if they had it, refer to them, and as you get ready to do the vote, you can ask the group, are we ready to vote? Are there any new comments on this? I'm hearing a lot of similar feedback now. It sounds like we're ready to vote. Everybody hold up, read the question one more time, and then ask everybody, hold up your voting card based on the extent to which you feel our public health system is the extent of activity going on within our public health system related to this specific question. In terms of when do you vote, this can be tricky because sometimes you're really pressed for time, although I think groups now are going to have the luxury of time more so than with the previous assessments just because there are far fewer questions. So hopefully you won't be quite as pressed for time and quite so eager to vote on everything. I think there'll be a lot more opportunity for discussion. But some of the things that I do with groups are, again, ask them, are you ready to vote? Or I listen as no new comments are coming in, then I'll say it sounds like we're ready to vote. And the group will tell you, really we use them and ask them because they'll be pretty honest with you. Also, for some questions, it may be very clear that there's widespread agreement, that you don't actually need to have 10 minutes of conversation about something because everybody is in agreement and they've sort of exhausted all of the comments in that area, so you can quickly go to vote. I will say that sometimes, issues come up where, there may be people who are concerned that, they're in the minority vote and they want to make sure that their feedback is heard. We've experienced this, and honestly, as a facilitator, I think it's really important to assure them that their comments are being captured in the notes, that we value their input, and, if necessary, ask the note taker to make a comment in her final version of the tool where she's capturing the actual scores. Ask her or him to make a comment that there was major disagreement here for this issue so that you can move on, but that you've been responsive to someone's concerns. If there's a tie, we've found this in the past, you can just record it as a tie, and then when you go to put in the scores, maybe input the more modest approach if you want to take a more conservative view of the assessment, since this really is for the purpose of improvement. Alternatively, you can ask the group, okay, we've got a tie on this. Is there anybody who wants to weigh in and see if they can persuade someone to vote differently? Is there any new information that might be helpful to break this tie? And if not, again, sort of record it and move on. In terms of capturing the scores and comments, one of the things that I've found is, again, it's really helpful to have that final response, that final vote, the score that you will put into the system. There are groups that have anxiety about losing some of the other scores, so why aren't we capturing all the green votes and all the red votes and all the yellow votes? If that seems to be a big issue among your participants, it's fine to capture it. I don't know, in my experience, it didn't prove to be really useful in the end, but if that gives reassurance to the group that their input is being captured, then if you want to get volunteers to count the different colors of the voting cards, that'll expedite the process. You just want to make sure that you're not spending lots of time counting each vote, because that can take away from the process. In terms of capturing the qualitative comments, there are templates that you can use, and I believe one is available on the toolkit. I've found that it's not really helpful to capture all of the discussion verbatim and to quickly take notes, on everything everybody's saying. What I've found instead that's really helpful is to capture the model standard number, to capture comments in terms of strengths, weaknesses, and immediate improvements, and then to capture priorities and other comments that are really meaningful, that are sort of worthy of being put in the notes. Otherwise, you've got, with 10 breakout sessions, just this enormous amount of qualitative data, and oftentimes the state public health agency, who typically is leading this effort, may not have the capacity to really sift through that and do the thematic analysis and sort through and analyze the data. So if there's a way you can organize your template and your qualitative comments while the discussion is taking place into these buckets, I found that that's incredibly helpful. Okay, so let's do a walkthrough of what one essential public health service might look like. So for essential public health service number 1, we'll focus on Model Standard 1.1, planning and implementation. So let me just start this out. So welcome everybody, I've done the introductory remarks. Let's get started with essential service number 1, monitor health status to identify community health problems. So this essential public health service focuses on what's going on in our state and do we know how healthy we are. This service includes an assessment of statewide health status and its determinants. It includes an analysis of the health of specific groups that are at higher risk for health threats than the general population. It includes the identification of community assets and resources. It includes the interpretation and communication of health information to diverse audiences, and it includes collaboration in integrating and managing public health-related information sessions. The systems partner, so who's involved in activities related to this essential public health service? Well, lots of folks, including state governmental agencies, physicians, nurses, other reporters of health data, hospitals, other healthcare facilities, obviously local public health systems, particularly those involved in data collection and reporting, university or other academic institutions, public health institutes, public, private, and voluntary organizations that use health data, and probably others as well. So let's talk about what we're doing in this area. Let's talk about essential service number 1. So I'd spend time now just engaging the group in a general conversation about what and how we're doing across the state related to monitoring health status. I'd remind the group about focusing on the system. I'd capture their comments on a flip chart, and then I'd quickly try to summarize key points from the discussion and get the group excited about addressing the question. So I'd try to do that all in about 15 minutes or so. Then once that summary has been done, I would transition over to the model standard. So I'd let the group know, okay, so let's get started with our first model standard, 1.1, planning and implementation. Remember, we've got 4 model standards for each section. Let's focus on the first one. So this model standard has 3 questions we're going to address. For this model standard, I would then read the abbreviated version in the facilitator guide, and then I would jump into the first question. So I would ask the group, how well do state public health system partner organizations maintain data collection and monitoring programs designed to measure the health status of the state's population? And while everybody's thinking, I may actually even read it again, and then I'd just pause and wait for someone to chime in. And then I'd look to the discussion toolbox to see if we, if folks are having a hard time jumping in, to see if that can generate more input as well. So it really is that straightforward. And then, when it gets time to vote, or when I notice, I feel like the group is ready to vote, I'll ask, are we ready to vote? Has everybody who wanted to provide input chimed in on the conversation? Okay, great. So I'll read the question again and then hold up the voting card. So that's the process. Okay, in terms of tips now, I wanted to provide a few tips for facilitators. Again, some of this is based on my own experience with these processes. I've learned that, this can be somewhat tedious going through all of these questions, especially, when there were 900 questions or over 600. I don't think this process with this newer version is going to be quite as tedious, but I've learned that providing incentives to the group can actually go a long way. Listen, we've got 2 more questions to answer, and then we're going to break for lunch. Let's just get through this, and then I'm going to give you a break. Recognizing progress, acknowledging the participants for the great feedback that they've generated, assuring them that the comments are being captured in the notes, and letting them know, great, we've already gotten through half of this essential public health service, we're doing great work, this is exactly the type of feedback I was hoping we were going to get. Giving that feedback, I think, again, goes a long way. Reviewing the findings, again, the note takers and facilitators can figure out, what's the best strategy for working collectively on this. This sometimes comes up when people want to revisit, I'm not sure, we voted this way, what did we say earlier? So, figuring out a system where the note taker and the facilitator can work together seamlessly, I think is really important. Referring to the ground rules, if somebody's getting tripped up in the process or was concerned about making sure that, all of the votes are heard, or, concerned about how this information is actually going to be used, and if there's only one vote, again, refer to the ground rules. Express your confidence in the process, remind people that they've all agreed to, engage in a dialogue focused on this assessment tool, and that they're not going to get bogged down with the process. And then, there may be other tips just based on your own experience facilitating assessments or other processes as well that have worked for you in the past. So in terms of meeting logistics, I wanted to just spend a minute or two talking about meeting logistics because this really does matter. When I facilitate processes like this, I always want to know, what's my room assignment? How is the seating going to be laid out in that room? I want to make sure it's not classroom style. I want to make sure that it's set up in a U so all participants can see each other, not just me as the facilitator. So I want to make sure it's conducive to a group discussion. I also want to make sure that I have table tents or name tags so that as the facilitator, I can call on people by their first name. I can quickly write their name down as I'm keeping a list of who's next, who's going to be talking as soon as this person wraps up. I also want to know what's going to be in participant packets because that's going to have an impact on how much I stress during my introductory remarks and if I'm able, in fact, to call their attention to things in their packets, such as, a one-pager on the voting response options. I'll also want to make sure if I'm planning to use flip charts for anything that I have those in the room and that I know if I'm going to be writing on the flip chart or if the note taker is going to be writing on the flip chart and for what elements of the discussion are we going to be capturing comments on the flip chart. Is it only for the overview session when we talk about what's generally going on with that particular essential public health service? And then also, given the room assignment, I'll want to figure out what's the best place for me to situate myself as the facilitator and where should the note taker be. So all of those meeting logistics, I've found it's helpful to think about and prepare for ahead of time. So in summary, what can I say about this? It can be a lot of fun, and I think it's really helpful to share your enthusiasm for this process and how these data from the assessment, are going to be used. I think have fun. Be confident in your ability as a facilitator to guide the group through the voting process, through the questions, and to get really good data that is going to inform your improvement process moving forward. And then finally, I'll say make sure you do your homework. I think your level of preparation will show in these meetings. If you've had a chance to take a look at the facilitator guide, if you are familiar with the questions that you're going to be asking the group and any potential sticky issues and who's going to be participating in your session and the agreed upon ground rules and the decisions you've made as a planning team, I think that preparation is going to come across and you'll look organized as the facilitator. So, do your homework, be confident, share your enthusiasm, and again, have fun with the process. And Denise, that concludes my remarks, so I'll turn it back over to you to close us out.
Great. Thank you so much, Brenda. So Brenda, thank you again for the great webinar and for sharing your personal experiences facilitating the state assessment. I also want to take a moment to thank our participants participants for taking the time to view this webinar. And if once you have completed the webinar you still have further questions or you're in need of any further technical assistance or training, my contact information is up on the last slide, so feel free to email me directly and I'm happy to help. So thank you again for joining us and have a great day.
Thank you. Please stand by.